All right. Good evening, everybody. Welcome to our event for Pregnancy and Infant Loss Awareness Month. Tonight's feature is on the impact of mental health. And this is a topic that we often, I think as a society, we kind of minimize and put into a little box and throw it over our shoulder and don't speak of it. This month is Pregnancy Awareness and Infant Loss Awareness Month. And so this month I've scheduled at least 2 events a week throughout the rest of the month, throughout the entire month, to highlight this topic of PALS and why we need to be talking about it. And I'm really excited because I get to feature incredible practitioners and different community resources that we have locally in Maryland and nationwide. And so tonight we have all Maryland locals for mental health, and these are all very valuable resources with regards to people who have experienced and are currently experiencing a loss. And one of the things that I think we also have to talk about once we get going in the conversation is that for most of these panelists, they also include the partners if there is a partner involved, because that's a key piece of the conversation that we don't often think is an important piece when we talk about pregnancy and infant loss. So without further ado, I just want my amazing panel here, our amazing panel, to go ahead and introduce themselves, and then we'll kind of get going in the conversation. So whoever wants to go first, I'm not the teacher that picks on people, so. I want everybody to go first. Okay, awesome.
So my name is Heather Silver. I am a perinatal specialist. I'm a licensed clinical social worker, and I have a practice, Silverleaf Counseling Services, that specializes in perinatal mental health and perinatal palliative care, as well as perinatal loss. I'm based in Annapolis and Severna Park.
So grateful to have you.
Thanks.
Okay, Liz, you go.
Okay, I'm Liz Kent. I'm also a licensed clinical social worker and own a practice in Towson called Parithos Therapy, and we specialize in maternal mental health, so kind of the whole spectrum around perinatal care, and then kind of beyond into the young parenting years as well.
Awesome. Tiffaney, who are you?
Hi, my name is Tiffaney Mills. I am a licensed clinical social worker practicing in Olney, Maryland, also specializing in maternal mental health with an emphasis on women of color.
I'm so grateful to have you here tonight. And Dr. Julie.
Hi, I'm Dr. Julie Bindeman. I am a reproductive psychologist, and I own the practice Integrative Therapy of Greater Washington that in normal times is in Rockville, Maryland, but right now it's virtual. Our team works with people of all ages, and several of us have reproductive psychology specialties. So we work with people that are undergoing infertility, pregnancy loss of all kinds, birth trauma, as well as perinatal mental health issues.
Awesome. Wow, I love this. I mean, I was telling Heather, like in the meeting, I'm fangirling because I think that, the work that you guys do is just so needed and important. And a lot of community resources don't necessarily have access to the mental health piece. It's more of like, okay, let's just get you what you may tangibly need when going through a loss, but we need to talk about the mental health. So when someone is going through maybe an impending loss, like they know that it's coming, but it hasn't necessarily happened, what would you say is the reason why someone should seek support now and not just later? Because that's something that a lot of people don't realize. And I know for Heather, you do a lot of hospice work with regards to perinatal loss. So can you speak a little bit about that?
Sure. I think what the struggle that we have is getting patients at the point of diagnosis. So you're correct in that we usually get them after loss has occurred. And if we can get them right when they're diagnosed, when the baby's diagnosed with a life-limiting diagnosis or anomaly, then we can kind of start that process, right? So legacy building and communication between the partners, communication, especially with the siblings, they are excited for this baby. What can we do with them to help them, with the grieving process to whatever level they can understand?
Yeah.
Kind of the planning for birth and death and then beyond.
Yeah. And so Tiffany, you work with a lot of high-risk families too. So is perinatal loss, I mean, do you see a lot, sorry, I'm like tripping over my words here.
Oh,
Do you
that's okay,
see
you're
a lot of
excited.
families with that regard for impending, like they know that there's going to be, you do?
Mhm.
Yeah. So
Yeah.
how do you have that conversation? I think because that's often like a big thing is that people kind of fear the conversation of talking about that piece,
Sure.
right?
Yeah, it's really difficult to think about that. If you think about just from a societal perspective, when people become pregnant, we think about babies and buying baby clothes and all of these different things. So to have even the loss of expectation and that this pregnancy will not be carried to term, or, there's some other anomaly that's going to happen that will take the baby's life, it's important to really talk about that and process all of those compound losses that everyone really experiences. And it's really helpful to think about, how is this going to be supportive for me going through this process, right? Particularly working with knowing that a pregnancy is not going to stay until the end, or after a pregnancy loss has already occurred, just noticing, how am I going to work through this given the involvement of the body, and what benefits would it have to have a validating, supportive environment that I can process all of those things, particularly for the birthing person.
Yeah. 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 I'm thinking a lot also like Julie, I know you run a few different groups, and that's probably one of the groups that you also run. So how do you see that? I'm jumping all over the place, but still going back to with an anticipated loss that's impending, is that something that you're able to help facilitate, or maybe all of you really help to facilitate the community aspect? Because usually we see support groups for after the loss. And I find that like if we're having these conversations now with preparing ourselves, like is there a community that people can connect with on that?
I run several different groups, but most of my groups are after a loss in some kind of way. But I do work with a lot of people who receive a poor prenatal diagnosis and come to me for some discernment counseling to try to figure out what is a good choice for them, what works for them, to think through what the different options might look like, and how they might feel. So that's certainly something that people have come to see me about, and to work with either individually or with their partner, as a way of trying to figure out what do different trajectories look like. And there's some great online support groups, especially for people who have received a diagnosis of fetal anomaly or need to end a wanted pregnancy. And those online groups hold space for people who are in discernment. They're specific though, so that if somebody chooses to carry to term, then it's no longer a group that makes sense to be a member of. But there are other groups where people who are carrying to term, I think Chesapeake Perinatal Hospice at Chesapeake has at least used to have it. I think that they still have it. It's not in my neck of the woods, but I know of them.
Okay. Yeah. Yeah, I think so. I see, at least in my practice, I mean, for those that are watching that aren't aware, I'm a licensed massage therapist and I specialize in reproductive health. So I'm seeing people who, fertility, pregnancy, and postpartum, but I also see a lot of people who have loss. And that's part of the reason why this topic is so important to me, because I'll see people when they have had recurrent losses, and then they'll have midterm losses, and then trying to get pregnant again, and dealing with how do we provide the right resources so that they can still work through the grief that they already had and that are currently having, because there's a lot of fear and anxiety that comes up with a previous loss, whether it's one or multiple. And so I think for me to hear a lot of those resources, it's important to be having a conversation, because we need to normalize that there is access to these. And oftentimes people don't feel like, I don't want to say that they belong in a group like that you were talking about, but people fear that it's not for them, and that, there's going to be a lot of the judgment that's placed on, seeking that type of support. And which is why having this conversation on getting the support from a practitioner such as all of you is so critical now more than ever, because, you know, we're hearing so much more during this pandemic about, like, we're at home, we're on our computers and we're reading the news. And so it's not like we can escape it, especially after, you know, I'm going to bring it up, Chrissy Teigen and John Legend's loss, right? And so it's bringing to light the subject of why we need to be talking about it, so that people don't feel isolated and don't feel judged for having experienced something that was out of their control, right? And so I want to be normalizing the mental health component of loss. Like, it's so important. And I see my clients on the table and then they start crying. Granted, like, I'm holding space for them, but it breaks my heart that no one had the decency, no OB had the decency to say, like, here's a referral to talk about your grief with somebody. Like, you and your partner should maybe have a conversation about how to process this, that if you're going to attempt to do this again, like, you're in a more healed space. And I get really riled up around that, because countless times no one talks about it, especially if they consider, you know, we'll say, like, a chemical miscarriage. It's still a miscarriage. It's still a loss. And so for doctors to dismiss the mental health attachment to that early loss is really, really hard. And today, in fact, that was a conversation that I was seeing amongst a few people, that, you know, the term chemical disassociated the grief to the fact that it wasn't a fully formed fetus. And, you know, it's like, you're valid in having these thoughts and this anger and the sadness, and we should be talking about it. I want to hear about your sadness. I want to hold that space for you. And so we need to make sure that we're talking about the impact. If we don't talk about it, what happens, right? And so I think that's, like, a huge piece. Sorry, I could go on, like, a whole big thing, but that's why I brought you here tonight. Like, we've got to change this conversation.
Yeah, I agree with you completely. And even just respecting everyone's different perception of what their loss looks like. Yeah. Should someone have a really grief-stricken experience? Absolutely, that's totally valid. We can hold space for that. Should someone else present differently? There's space for that also. Right. There's a lot of judgment that flies through, even in bringing up Chrissy Teigen and John Legend, of, why are we talking about this thing? Why are you posting about this thing? No. We don't talk about the baby. We don't do these things. And what message does that send? If I'm a birthing person and I have known that there is a child within me or a growing fetus within me and telling me don't talk about that, when I have bodily attachment to that, emotional attachment to that, what is that reinforcing for that birthing person? And what impact does that have on that birthing person's mental health, nor their family, their relationships, their other children? All right, so we need to be having these conversations and normalizing, considering, you know, the amount of pregnancies that are lost, right? It is something that happens. People don't talk about it, so we don't think that it happens, but it happens more often than we think. And I think about all of those people, and my reason for joining this work within my own family and experiencing those things. I'm like, my goodness, we need to support these people, right? These consequences could be dire, and there's no reason to suffer in that way. Should you choose not to, there is support available. There is help available. So just, like, normalizing that overall. We don't judge people for having a different experience. We want to welcome all of those things. Show up as your full, complete selves.
Yeah.
And to take back from what Tiffaney was saying too, is that we live in a society that is really grief phobic. So it doesn't matter what kind of loss we're experiencing.
Totally.
That doesn't know how to hold space, as you're talking about, Jessie. So, you know, the idea that you can hold space is a really new concept for so many people, because we just want to move on. We want to forget about it. We want to put it to the side. And I think the grieving people want that too. And there's then this mixed experience of what is happening in my body and in my psyche, and that I can't get out of bed or I can't stop crying, versus the messages that I'm getting, which is, well, you are only 7 weeks along. It's no big deal. It's just a clump of cells. Yeah. And that's not necessarily how that person feels about it. Or, you know, losing a pregnancy at 37 weeks. And it's the idea of, well, wait, it's been 2-3 weeks. Why aren't you back at work yet? Mm-hmm. And it's also the idea too of, just go have another baby and you'll be fine. Like, we can replace for a 1-for-1. That one baby just replaces the baby that we lost. And whenever I hear this in my work, I sit there and I go, oh,
Yeah.
so, when you lost your dad, did somebody tell you just to go find a new one? Just to replace him? Because, one-to-one replacement, no big deal. And I think that's when people sit there and be like, no, that's ridiculous. And I'm like, of course it's ridiculous.
Right.
Not for a baby either. So even just to be able to teach people how to hold space for grief, that grief is not pathological, that grief is normal, and that we have grief because we have love.
Exactly.
Absolutely. And I remember being really frustrated again, as you said, I got into this work because of our own journey to have children, but it was amazing to me that I was filling out my paperwork to get my 12 weeks off. And when my baby died, I got 2 bereavement days. So I get 3 months if the baby lives or 2 days if the baby dies. And that didn't make any sense to me. So one thing that I do when I go and I try to teach healthcare staff how to work with these families, and I will give them a book and bring a book with me, and I will tell them I want them to journal something, but it's an already written book. And they're like, well, there's no space for me to write. I said, no, you have to write on top of the words. And they're like, but you can't read them. That doesn't make any sense. I said, exactly. So when somebody sees a pregnancy test that's positive, I'm going to look big on my Christmas pictures. I'm going to have a baby in a bathing suit next summer. They write this complete book about their life that has this little person in it. And when that comes crashing down, that book is written. So when you go back to somebody at the holidays, or you go back to work, everybody is, why aren't you back at work? Just like you said, but they've written this entire book that they now have to write their reality over top of what's already in ink. And it's so messy.
Mm-hmm.
So messy.
I love that analogy.
Yeah, that's great. And with just like the normalizing piece too, like the mental health piece, but just like the trauma, because there's physical trauma and all, sometimes associated, and just like what goes on in your body and all the procedures that you have to go through if you can't carry out the pregnancy. And just, I don't think we even think about that if it's not something that you're actively going through, and just remembering that there's it's a much bigger deal than sort of people are like, oh, well, it just, well, yeah, you just lost a baby. And it's, physically, there's so much more to it than that too, which obviously impacts our mental health.
The amount of women that come to me that had no idea their milk would come in after a loss is unreal.
Yeah.
Because and a lot of the patients feel the same way. They're like, I just felt like the staff wanted to get out, and not all staff. Many staff are wonderful. Many OBs are wonderful, and MFMs are wonderful. But those that are uncomfortable, not because they want to be, but because they just don't know how to be, can really do some long-term damage when this stuff comes piling on. And well, my milk's coming in, and I'm still bleeding, and I'm doing this and I'm doing that. So when you mention Chrissy Teigen, it's the people that are offended, it's just this lack of education. And, why are you offended, right? It's because more people aren't sharing. It's because more people aren't talking. So nobody wants to be in this club where their baby has died. It's a crappy club to be in. But once you're in there, you had a loss and you had a loss and I had no idea this person had. So everybody comes out of the woodwork with their own losses. It's why am I knowing this for the first time? And we have been best friends for so many years. So it's so sad and isolating.
It's 1 in 4. And that's the part that's mind boggling. People think that nobody else, they don't know anybody. And I'm like, that's because they're all confining themselves in the closet and they're not sharing that they're they've experienced this. And then all of a sudden, for me personally, I had a loss 3 years ago, and I purposely came out on Facebook, but I didn't have any in-person conversations because I didn't know what I was going to hear back. And to me, it was actually more therapeutic of okay, I'm giving you this message and I don't want to talk about it kind of thing. And then people were coming out of the woodwork, and I'm like, okay, well, that was kind of what I was hoping for, is that more people would be starting to shatter that stigma and talk about it. And then every so often somebody would say something. I'm like, okay, well, let's have another teachable moment of how do you support someone, or what words would you, perhaps want to avoid saying if you know that somebody had a loss, those kind of things. And it's been really interesting because then since Friday, it's been a whole round of people who finally found their voice. It's not that they didn't want to, but it was like you were saying, that judgment piece, whether it was early or it was, later in the pregnancy, it's like, okay, like, are they going to think that I did something wrong? Are they going to think that like I didn't take care of myself and I didn't care about the baby? And then all of a sudden it's like, no, that's not it. Like I did everything I possibly could, and I need to tell people that like this is what happened. And it's been, as much as I don't like to rely on celebrities to bring light to subjects like that, that was, I think, kind of pivotal in the current state of how we've been talking about so much more of perinatal loss, that it almost was kind of, not to say that it was needed, because I don't want to say that, but it was somebody that has a lot of attention is bringing it to light. We've been talking about fertility so much in the last couple of years, with more celebrities coming out about their previous losses, and then they were finally able to have, you know, a full-term pregnancy. Like those are the things that I think celebrities do come in handy for, because then it's bringing to light that, okay, if it happens to them and they have a lot of money, then it can't be necessarily like a money thing. You know what I mean? Because a lot of times people associate that with celebrities, like, oh, nothing bad ever happens. They've got all these resources at disposal, and that's not necessarily the case. And like, we all go through loss, we all go through joy, we all go through grief, and all of these other capacities that I think brings the reality, you know, to surface. So.
And even talking about the IVF, kind of like you mentioned, we've been on this kick for a while. I've noticed in myself just how much is like, I had this IVF journey, but now look, I have this baby. It's still very much focused on the outcome of winning with the baby, and still just like not enough attention on what that looks like. What does IVF really entail? Right? All of that with the body. And like, some people go through many, many rounds and do not get that prize at the end. So it's like, we know that it happens. We're uncomfortable with it. We don't want to talk about it, but like, we need to. And the messages that reinforces when we still choose not to. Of course, birthing people feel like, I don't want to talk about this. I don't know how to share this. I don't need to go to therapy. I'm fine. Yeah. Right? It kind of reinforces those same things, which is really, really sad, because community can foster so much healing. Right? If I know you've had a similar experience, oh my gosh, it's not just me. Do you still cry about the loss of your baby? Right? Do you still have challenges when you see someone nursing? Do you still, you know, all of those things, just to be seen in that way and validated in that way? I like literally see the weight fall off of people, and like the tears behind that, and how sometimes depending on the provider, has not told them that their milk is still going to come in, right? And what that experience is going to look like. And we talk about doing no harm. It doesn't seem like doing no harm to me. Lack of information is harmful. Yeah.
Tiffany, you're bringing up a really good point, because I think people who go through an infertility journey, right, there's that prize at the end, which is the baby. I think people who go through a loss, there's also that assumption, and especially when people talk about their losses only after they might have had a subsequent child, again, it creates this assumption that everyone who has a loss gets to have a child afterward. And that, unfortunately, is not the story for everyone. And it's not because that's not the story they wanted. Of course, it's the story they might have wanted, but it might not be what happens. And so it can be really harmful too, to talk about that rainbow baby, that baby that comes after a loss, as an expectation versus as a hope. As, you know, this is what we're hoping for, but it's not a guarantee. It can't be an expectation. It can't be, you know what, just forget about it, go and have another one, or don't worry, you're young, you'll have another one. That's not necessarily everyone's story.
Or you've had multiple children before your loss. And it's like, well, you already have children, so what are you know, you've got enough, like, that's okay. And then so then we don't talk about that. And I know, like, Liz, you work with people who have family, like you do all of that, and I'm sure for you probably see a lot of that.
Yeah, I mean, just thinking about that dismissive piece, and how that it's still like this unique grief that people are experiencing. And I think even when it's different, right, when you have kids already, and then that innate like guilt, like we were all talking about, comes up, where you're just feeling like, well, now I'm grieving, but I can't grieve because I have other children to care for. And that's like a whole nother layer of feelings of guilt on top of everything else, that and it's almost like women try to push that aside because they feel like, well, I have my responsibilities, I have my family, I don't even have time to deal with this. And I think that is like a whole unique challenge of having to process the feelings that they're going
the
through.
Guilt comes from that when some women experience guilt from my work with, why am I so caught up on this baby that I didn't even know when I have these kids here that I've raised since birth, and I just like can't stop thinking about this, and then the guilt just like reinforces so much. Yeah.
So much guilt.
Yeah.
And even getting through a time period where they're finding their footing, and then they realize there was a day they didn't think about the baby as much, and then they have this huge amount of guilt that destroys them, that now I feel guilty because I didn't feel bad. So, talking about it to let them know that that's the expectation. It's, like you were saying, just knowledge is power, and lack of knowledge is making a struggle.
I think like so much of what I talk to women who are in the momming stage, like wherever they are, is that dichotomy that you were just like pointing out, of like dichotomy of feelings. Like we don't recognize in our society that you can have a day that feels okay. And that doesn't mean you have to feel guilty because you didn't feel sad all day. And that we don't give place to sort of hold two feelings that seem like maybe they're contradictory at the same time. Like we just don't know how to do that as a society, I don't think. That's something that I talk to clients a lot about, of just sort of accepting that it's okay to have feelings that sort of seem confusing. Like everything about parenting in like from the beginning stages is sort of like this dichotomy of emotions of like, people want babies, but then they're anxious about them. And, I mean, it's just like this ongoing sort of fighting feelings against each other.
And if I come back to work and I'm laughing, I'm not okay. I'm just in this moment. Yeah,
I think that's a really interesting perspective. I operate from a dialectical DBT perspective, and just always incorporating like a dialectical perspective. Like these two opposing things can absolutely be true at the same time. I could be mourning this and enjoying my living children, right? And I think that's something to really just like shift the way in which we think, because just like those reinforcing thoughts can absolutely reinforce the way in which we feel and the way in which we interact with our families, and even considering the partners who are also grieving the loss associated with a pregnancy loss or an infant loss or anything like that. Not just the birthing person, it's the children who were expecting a sibling. It's the partner who's expecting a son or a daughter, or, and all of the nuances that come along with that. And like the interpersonal challenges, like, do we have sex again? I don't feel comfortable having sex. Like my milk and my body, like all of these different things are coming up, and that can absolutely reinforce more loss and like more compound loss. I feel disconnected from my partner, disconnected from my work, someone like got laid off, and like, so all of these other things, when we talk about protecting our mental health and like noticing what are those warning signs that maybe I need some additional support, right? Am I getting that from my OB or my midwife or the hospital or whatever that looks like? And I like to teach people like, when are you noticing that maybe this is a time where you might need some support, right? Because sometimes like anniversaries or different things like that, how do we foster that healing together? Just considering that we spend so much of our time with other people, and those people are also going through a similar, maybe not the exact same, but a similar experience. And the more we talk about it often, it gets uncomfortable and it gets hard. And at the same time, I think it really takes the load off in some ways. Just like, okay, we can talk about the baby by name. Okay, like we can do this. And at first it just feels like, I don't want to think about it, right? And the more we just like practice, even just like noticing, how do I protect my mental health? How do I talk about feelings of loss or depression or guilt or having so much anxiety that I'm going to lose another child, or being afraid to have sex because I might get pregnant again, and all of these different things, and why it's important to take care of ourselves physically, but also emotionally and mentally, especially during times of significant loss.
When we talk about how do we prepare people for that journey ahead, one of the things I try to tell people in the first session, whether I'm seeing someone individually or they're with their partner, is that I can guarantee that there will come a time where their grief is going to feel different. And it's going to be kind of a parting of the ways in terms of how each of them is experiencing grief. And it's always so interesting to me, because when I see people in the beginning and they're so aligned and both are feeling the trauma and the crisis of it, And they're looking at me like, no, 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 we are going to be in lockstep. We are so in sync with one another. And it's like, yep. And you will diverge. Your grief is going to diverge.
Yeah.
You've had different experiences. You've had different somatic experiences, different emotional experiences, different dreams and fantasies of it. And that's not bad. It doesn't mean that your partner doesn't care just because they're re-engaged with life and starting to talk about, hey, when do we try again? And it doesn't mean that they've forgotten. It doesn't mean that they're not hurting on occasion. It just means that they are managing grief really differently. And that's okay. That there's not a one size fits all with grief. There's not, you don't have to be crying in hysterics all the time only to be grieving. There's lots of ways that grief can look. It can look like anger. And I don't think people really connect that grief can be anger. Grief can be just being really pissed off and wanting to hit things. And grief can be trying to numb yourself. So we see a lot of times when people are grieving, they tend to drink a lot because they just want to numb, to forget. So grief can look so different for different people.
Mm-hmm. Yeah, we talk a lot about the grieving silos, right? Like just like you're saying with the men and women, where I'll separate a couple and I'll hear her say he doesn't bring it up. I come home, he comes home, they're going about their life. They went back to work. I feel frozen. And then I'll bring him in and he'll say, I thought about it all day. I wanted to punch my windshield, but I came home and she wasn't crying, so I didn't say anything. So I'm always trying to pull those conversations together, just like you were saying, because you're absolutely feeling it. And, often in our society, the men are the strong ones. Right? So they're there for mom's partner. And as we see, the birthing partner kind of gain a little bit of footing, I often see the other partner fall a little bit because they don't have to hold on so much. And then what does that look like?
Yeah,
it can be very sticky.
Yeah, and I do want to be mindful too, is that for my practice, I do see a lot of same-sex or non-binary couples. Yeah. And so for them, it definitely brings a different, unique perspective of like the guilt of like, well, what if I had carried, or, maybe I should do it next time, or what can I do? Like a lot of these thoughts go through it. And so I just want to, bring the topic to that, because so much of the conversation is cis heteronormative, language and conversation. And I think that it's also important to be inclusive when we do talk about that aspect, because there is a set of grief that can be unique on that perspective of
so much and so much harder sometimes. So that's why when you're trying to talk to staff about what to do, that partner is the forgotten griever almost, right? So pull them in. Can they make decisions together? Can you have these conversations together? Can you, make choices? And absolutely, thank you for bringing that up.
Yeah. I think also it can be really hard for gay dads who might be using a gestational carrier to have their baby, because people are not seeing them pregnant because that's somebody else who is pregnant. And then how do they mourn as three separate people, but also these three people who are connected together? And it's a really disenfranchised kind of loss, because people might not have known that they were expecting. Right. Again, sort of this really invisible kind of loss, and they might not really understand or know how to feel. It's like, oh, wait a second, and might get busy sort of in that idea of, okay, let's go try again, sort of with the details and the ideas of like, okay, what can we proactively do, because it feels better to be in a state of doing versus a state of feeling. And I think all of us are kind of talking about that, where people want to do, they want to fix, they want to feel better, they want to know what it's going to look like, and creating that space just to feel, to slow down and to feel the painful feelings, the ugly feelings, the envious feelings, the confusing feelings. And that feelings are not, as you were saying, Liz, they're not this either or, they're not a binary. We don't experience feelings as a binary, but we would like to, because that's much easier to experience. Okay, I am sad now. Okay, now I think that's kind of funny over there. But to have those things happen simultaneously, it's so confusing and so hard. And just like everyone's been saying, we don't have language for it. and we don't have ways of holding it.
I think one of the other things that's important with like the grieving process between partners is just how, sort of like what you were saying, Julie, with just people kind of travel that road differently, but that how they see the world might be different afterwards, or how they parent differently. Those other kids might be different afterwards. And so that can create a lot of tension and stress between partners, and like trying to navigate those dynamics. It's like sort of almost like this aftermath loss of the loss, of trying to like reconnect and figure out where you stand with your partner.
One of those gifts of grief that I'll tell people, if I told you would get so many gifts from the grief, you'd want to punch me. But as you move through time, I'm going to kind of pull them out, of seeing life's fragility, of just, seeing your other children in a different light, or being able to be that support person to somebody else who you find out, those things.
Absolutely. And just also just normalizing to the people. I find that a lot of people, and myself included at times, like when experiencing a loss, I have the expectation that I am to bounce back like right after. And just knowing that even if, whether we lose a home or a car or a pet, we go through that transition period where like our sleep is off, maybe we're a bit more crabby, our eating is off, like all of those things are there. And like, that's okay, right? Major life changes call for like a time to readjust and like try to figure this out. So that's okay. It's okay if you feel that way. It's actually quite normal to feel that way after experiencing a significant loss. It's okay if you feel that way every October, right? It's okay if you notice when you see Chrissy Teigen, oh, I think about that thing, right? That's the way in which our minds work. And just like noticing like where that judgment comes in, and like, it's okay to feel that way. It's actually really normal to have these experiences.
Especially as a caregiver, that could be a whole nother panel discussion.
Yeah,
about
I'm like
us going through this as a, doing this job and having losses while doing this job, and how do you show up? How do you oscillate from your grief to holding, space for somebody else, and who helps the helper?
Yeah,
so,
helper.
Yeah, that was pretty much our conversation. So on Monday night, we had an evening for birth workers who have personally had loss. And so as you guys are birth workers too, because you're doing perinatal loss, perinatal mental health and postpartum. Anyway, you get the point.
All of it.
And we were talking about like how we have to be on like all the time when we're with our clients. And then it's like, sometimes something will be said, or you'll feel like the energy of something. And then you're like, oh, it hits you. It's like a big crashing wave, right? And then you're like paralyzed, and then you're like, okay, this is not about me. Like, I got to be present for my clients. Like, this is who the priority is, and my loss is not valid right now. Like, how do you, it's like, that is like a whole nother conversation. And we did have to talk about that. For some of them, they're at birth, and it's like, it can be constant triggers if they were present at a loss. And it's just one of those things that as givers, that I think that we're not great at giving ourselves permission. And I know that you mental health providers like can be quite the tricky ones too, because you're great at giving other people wisdom. I mean, right? I mean, seriously. But it's like one of those things. And sometimes we forget that we are worth being taken care of too, and our mental health state matters too, and that it's not necessarily always fill the cup, but it kind of is. And especially like the oxygen mask piece, which I think Rachel Naomi Raymond writes it quite often in her book. If you've never read any of her books, it's like we forget how essential that oxygen mask is. And that especially when we're coming to support other people with something that we have personally experienced, we have to make sure that we've got some type of support already provided for ourselves so that we can fully be present and help the people that we're trying to help out. And I think, a lot of times that can also come with support from community. And we forget the validity of how essential community is when it comes to this. And, for at least in April, when we were talking about, I we had a whole other series of topics on infertility, and that was a really great subject. So maybe you guys will come back for that one this year or 2021. And one of the biggest things is we talked about it within Black communities, because the topic of loss and infertility isn't necessarily always talked about. And just like even with cancer, and it's like we've got to be breaking these stigmas and talking about the things that are so essential. And I'm really excited that at the end of the month we have a few different organizations who are going to be present, including I can't believe I just drew a blank. Sorry, I'm like SAILS, which is Stillborn and Infant Loss Support. We're going to have Elijah's Hope Foundation, which is based in Baltimore. And then we're also going to have Sisters in Loss, which is another really great organization. And, these are so these incredible organizations are fostering community. And I think that's one of the essential things, is that they're talking about, okay, these are other people who have been through it. Like, let's create that support system. Okay, so let's get mental health involved. And these are people who are talking about that, like why we need to be talking about it. And so if y'all want to check out those events at the end of the month, they're like a few of my favorite people, especially Tamira and Erica with their two organizations. So anyway, that's my little thing on that. But tonight I feel like we could talk about all of this many hours, and I think that what's really important is to know that this is just the beginning and it's not the end. And when we deal with grief and loss, that that is just a piece of the story, and what we bring in to support that story, all the additional characters, like that's what builds up the journey and how we pull everything in. And really grateful to have all of you on this evening. We definitely need to talk about the partners. We need to talk about, more of the community. We need to talk about like all the things, and there's just clearly not enough time. But with the remainder time, what else, if, for people who are watching, and I know that there are people watching right now who have experienced a loss very recently. We're talking like within the last couple of weeks, and there are some people who are watching who have experienced loss years ago. So if you were, if they were sitting in front of you right now, like what words of wisdom or guidance would you say? Like, what is your takeaway for tonight?
I would say, and what I do say to people is, loss is one thread of the tapestry you weave in life. And that any single thread doesn't have to define you, that it's certainly going to be something you will carry with you. It's going to be part of that woven tapestry. You can't just pull it out, but it doesn't have to define you. So you get to decide how you live with your loss.
Yeah. I just like to tell people that thank you for trusting to even come to see me, and your losses, your feelings is all valid and normal, despite what the media might tell you, or your partners, or your family, like any of that. And especially given what we're all experiencing, I feel like this year has just had so much loss, just like even with the pandemic, we are all so much more vulnerable to those like emotional dysregulation that kind of comes along. We've been like locked at home, and some of us don't have homes, and virtual learning and school and pregnancies, and, Black Lives Matter, and, a lot of my clients struggling with anticipating loss of a child for racism and other, it's just so many things that are compound. We have so many vulnerability factors right now. So if you're noticing any of those things, a lot of things are being offered virtually, but I find that the connection and the healing can be just as powerful through a screen. So reach out, ask for help. And support. It is not a sign of weakness. It's actually a sign of courage. To ask for help is very, very courageous. And it is a privilege for me as a provider to support anyone wanting to come into contact with more healing. You're not a burden.
No, not at all.
Not at all.
Exactly.
Quite the
Yeah.
opposite.
It is always such an honor. And, you brought up a great point with, just the pandemic and the state of the world, where a lot of people that were pregnant during this, many of their coworkers didn't know because they were working from home and their family didn't get to see them. So they didn't get to share that. So there's almost a little bit more of the isolation piece in it. But what I would tell them is that you matter, your babies matter, your relationship with them matters, and your grief matters. So absolutely reach out, call somebody, call friends, talk to someone, join a group.
Yeah, and I was just thinking about the normalizing piece and just how important that is, of just this, you're not alone in this. And I think sometimes it just coming, if people get the courage to come to therapy and can talk about it one-on-one in a setting with somebody that they feel like is listening to them, then it gives them sort of that added courage to go and talk to like a friend, or to go to a support group or some other place where they can sit with somebody who maybe has shared that unique loss. And that can be really comforting. So just to remember that you're not alone, and there is support. We all do this because we want to do it, and because we care about the work that we do. So, and we want people to feel better and not be just sitting in grief forever, you know?
Yeah, I think you guys all bring up such incredibly important points, and I'm forever grateful for each and every one of you on for this evening. If you have specific organizations that you support, either that you run or that you use as a resource, I'll add it in on the comment section. Sorry, my dogs are barking at something. Timing is impeccable. If you have an organization or a support group that you would like me to share, I will add it into the comment section of this video. And y'all were worried about your children. I'm worried about these barking things.
Well, we're going to run out of gummy bears down there.
Well, that's what I needed for these guys. Sheesh. But I will make sure that any of those resources and any of those links, including all of your business pages or how people can get in touch with you, we'll put all of that in the comments section for the viewers of tonight's panel. Again, thank you all so much. And, you know, the comments that are coming in is that you guys spoke such truth, and that we need to normalize, you know, this topic. And so I definitely see us maybe getting together again, and maybe something more specific within this topic that we can break down and destigmatize. So thank you so much. And
thank you for organizing.
Yeah. So if
us to be part of this.
hold on for 1 second, we'll kind of get this wrapped up, if I can make it all happen the way that I need to. Technology.